Fit FM is owned and operated by Communistation Company Limited, located in Stuart Castle, Duncan's Trelawney, Jamaica. We broadcast on FM 96.7 locally and is heard worldwide on fitfmja.com. Our mission is to amplify diverse voices and opinions, inform, educate, entertain, and engage listeners of all ages and lifestyle while promoting responsible community development. Fit FM 96.7. Your life, your music.
Are you struggling with loneliness? Feeling depressed? Are you searching for a purpose to live? Are you ready to tap into your inner greatness? Ready to soar to your full potential? Come and be inspired. Join me, Dr. Asha Mwendo, on Healing Moment inside Gospel and Soul every Wednesday, 6 p.m., where we will help you to understand your purpose. We will help you to find your wind. We'll show you how to open your wings and fly. Healing Moments, Fit FM 96.7, your life, your music. Good evening, my people. How are you this evening? It is good to be with you again. It is a Wednesday and it is Healing Moment on Fit FM 96.7, your life, your music. And you know, we're bringing to you this evening an awesome program, and we're praying that all will go well. I don't know how it is in your neck of the woods, but remember, whatever is going on, God is still in control. You just need to give in to Him and listen, and He will take you through. Don't mind the storm, because the Master is in the eye of it, and He will take you through. So we're going into Healing Moments this evening, and we're talking to our women and to our men who love our women. We're talking menopause. And so you know how it goes already. We want you to listen to us, send your messages in. What, everything you have concerning menopause, let's hear it. Let's hear your question. Let's hear your suggestion, your thoughts. Let's see how it goes. So remember now, you can link with us on Fit FM 96.7 on air, or on 876-478-9144 or 876-513-668 is our other number. We are now working on our fitfmja.com platform. However, if you put Fit FM in on any of the radio apps, it will also come up, partner radio apps. It will come up. You can find us. Go on Facebook, go on YouTube. You will find us. Listen in, share in the conversation. Let's hear from you. And as usual, Healing Moments, join the call for elimination of violence against our women and our girls. It must stop now, right? And so our guest for this evening will be Dr. Radine Wallace. And as I told you already, we're talking about menopause, but you know the drill already. You're going to get a pen, Tell your friend, get your sip, and listen to this bit of music until we come right back.
The warrior. Oh, na 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 na. The warrior. I do it on Christian. The warrior. I'm just Satan, not this you know. The warrior around me, yeah. God put you all on me. Satan, me know you can't stop me. The water around me, yeah. God put you all on me. Satan, me know you can't stop me. Him can't go around me wall, him can't go above me wall, him can't go under the wall. No, sir, nothing him can't do me at all. So when me lift up me right hand up there, when me lift up me left hand, man I shout praises to God all around the world, man different. You understand? The water around me, yeah. God put you all around me. Satan, me know you can't stop me. The water around me, yeah. God put you all around me. Satan, me know you can't stop me.
Jesus feel offense, now I want you out all the evil deeds, me stand tall. Who be them a pray, but I got me a call up on me knees, make the enemies fall up. And one thing them no know, say me covered so I better them go. One thing when me sure the wall is stronger than the one at Jericho. Oh yeah.
The wall around me, yeah. God put you all around me. Satan, me know you can't stop me. The wall around me, yeah. God put you all around me. Satan, me know you can't stop me. What if me tell you said the wall God build around me can build around you? What if me tell you anything God do then he can do it again in front of you?
This me I want you. Yeah, God I call you. There's nothing he can do. At this you feel know.
The wall around me, yeah. God put you all around me. Satan, me know.
Friends, now I want you out all the evil deeds, me stand tall. Who be them a pray, but I got me a call up on me knees, make the enemies fall up. And one thing them no know, say me covered so I better them go. One thing when me sure the wall is stronger than the one at Jericho. Oh yeah.
The wall around me, yeah. God put you all around me. Satan, me know you can't stop me. The wall around me, yeah. God put you all around me. Satan, me know you can't stop me. What if me tell you said the wall God build around me can build around you? What if me tell you anything God do then he can do it again in front of you?
This me I want you. Yeah, God I call you. There's nothing he can do. At this you feel know.
The wall around me, yeah. God put you all around me. Satan, me know you can't stop me. The wall around me, yeah. God put you all around me. Satan, me know you can't stop me. Him can't go around me wall, him can't go above me wall, him can't go under the wall. No, sir, nothing him can't do me at all. So when me lift up me right hand up there, when me lift up me left hand, man I shout praises to God all around the world, man different. You understand? The wall around me, yeah. God put you all around me. Satan, me know you can't stop me. The wall around me, yeah. God put you all around me. Satan, me know you can't stop me.
Jesus feel offense, now I want you out all the evil deeds, me stand tall. Who be them a pray, but I got me a call up on me knees, make the enemies fall.
Yes. Welcome back. God puts a wall around us every time. So we're going to just do a quick Let's Talk. I want to bring up our Let's Talk. You know, of course, go through our life's journey and we have persons who support us along the way. And for me, One of my biggest supporters is my husband, and tomorrow is his birthday. So I'm giving him a shout out as his birthday comes around, you know. Unfortunately, he gets it at the end of the month, so he don't have the whole month to celebrate. But you know, we're gonna let him feel special just the same. So shout out to Leggy on your birthday. I want you to enjoy it. And if you like how we believe sunset to sunset, so the birthday start already. You know. All right. So it starts already. And also want us to be aware that we are doing the 16 days of activism against violence against our women and our girls. And this year we are doing it under the theme Invest to Prevent Violence Against Women and Girls. Let's come together and band together to protect our women and our girls. The 16 days started on November 25th and it goes up until December 10th. Sunday, December 10th, it ends. But we know, even though the 16 days comes to an end at that time, it never ends, and we will not stop until our women and our girls are safe. The colors that mostly wear this time of the year for the activism is orange and or purple. So pick the color you like and let's support our women and our girls. And of course, you know, we have Thursdays in Black still the same, standing again against violence against our women and our girls. And we know coming December 1 is World AIDS Day. Yes, HIV is still with us, AIDS is still with us, and we need to get persons thinking again because some persons are slacking off and we need to get it our acts back together and pay attention to the things that are affecting us. My wellness tip for you this evening is just a reminder that even though the time is getting cooler, you still need to be drinking your water. A lot of persons are not rehydrating enough. Get your rehydration. And please, too many persons are getting, having poor health because they don't have no vitamin D. We live in a country like Jamaica where the sun out there every day. We're not making use of it, right? So let's go out in the early morning, get our vitamin D. And if you're not getting enough, get your supplements. Take care of yourself, get your vitamin D3. We want all of us to be healthy as we go into the holiday season. Whether you celebrate Christmas or not, that's not the story we're talking about this evening. We're talking about holiday season. And so we have gone far. I know some of my listeners are anxiously awaiting the opportunity to hear from my guest this evening. As I told you before, my guest this evening will be talking about menopause. He's an obstetrician and a gynecologist. And you know how I normally do it already? I don't tell you everything about them. I have to leave something for them to tell us about themselves. So I will tell you that he is licensed and certified and trained to be here because he's an obstetrician, he's a gynecologist, and he's a multifaceted, quintessential man. He is in so many things. One I think I like about this gentleman when I, met him is that he is a Christian and he practices life of Christian principles, an alumni of Magati High School. And so, and he's from St. Elizabeth or he went to school in St. Elizabeth. He'll tell us how that goes. Everybody knows how that I was born St. Elizabeth. I'm not from there, but my husband is. So this evening, my guest is, he will tell me if I pronounce his name correctly, but for now, we're calling him Dr. Radine Wallace. And so welcome, Doc. How are you?
Thank you very much, Dr. Asha. I am great. I am delighted to be here this afternoon. It's really a pleasure and an honor to be here just to explore issues affecting women's health. I'm just a simple guy, as you said, from one of the most beautiful parishes in the world, St. Elizabeth. From a humble background, went to Makati High School, one of those non-traditional high school. I always tell people it's not the school you go to, it's what you want to become. From grade 7, I've always put doctor on my dictionary until it manifests. Went on to Manchester High School for 6 months, and then went on to the University of West Indies, where I did my undergrad in the Bachelor's of Medicine and Surgery, and then subsequently my postgraduate studies in obstetrics and gynecology, the most fascinating and enticing aspect or facet of medicine. So I'm here, been doing it for over 15 years. I'm a consultant obstetrician gynecologist, works at Falmouth Hospital, as well as my office, Ladies Medical and Urgent Care in the town of Falmouth, and a few other offices. But I'm here ready to talk about this pertinent issue, menopause, and how it affects women, and whatever other issues that the time will allow me to explore.
Okay, so the first question I'm going to ask you, Doc, is I want you to tell the people who is an obstetrician and who is a gynecologist. Let's get that out of the way.
So yeah, man, an obstetrician is an aspect of medicine that deals with the pregnancy aspect of the woman in terms of from the pre-pregnancy, during pregnancy, and after pregnancy. So he deals with life within a life, mother and her baby. As it relates to the gynecology aspect, everything that affects a woman outside of the pregnancy physiology speaks to the bleeding issues, menopause issue, fertility issues, fibroid, cysts, all the different types of cancer, ovarian cancer, so woman's health. And then the obstetrics aspect deals with the mother and child, and in terms of the processes of pregnancy, the physiology from the start to the end of pregnancy.
Awesome. So gynecology part now. Tell us a little bit about that.
So with the gynecology aspect, as I said, it's a very vast aspect where women health in terms of from childhood, a young from a baby to menopause until death. You have the different issues that affect a woman's menstrual cycle, the ovarian cycle, the bleeding syndrome.
Yes.
The cancers.
Yes.
The cervical cancer, the pap smear, the surgeries and fertility issues. Importantly, the physiological aspect, discharges, we deal with infections, the bacterial vaginosis, the yeast infection, and we look at any treatment.
And other ways to care for the women.
Yes, definitely.
Right. Okay, so you're a little pitchy. You're going in and out. Let's see pray that this picks up and gets better. Okay, so Doc. So the first thing I want to ask, what is menopause? But before you even tell us what is menopause, why every problem women have, men have to be in it? Down to the pause.
That's what life is about. Life is not life unless man is in your life giving some trouble.
Not true.
Your husband's birthday is tomorrow. I know the trouble is going to be good trouble.
Hear you that? Yes.
I don't know why they didn't call it menopause, but they said menopause. So
yes, I guess it was coined by a man.
I suspect it was. So menopause, it is defined as a period in a woman's life where she goes without a period for 12 months, and it's not pregnancy or any other disease processes. So it's an absence of a period for 12 months. Now, it's a transitional process, meaning it starts maybe in the mid-late 40s, and it expands the duration to at least 4 or 5 years until you reach 50, 51, which is a mean age, especially in Black women, where menopause actually happens. Now, before menopause is officially defined, you will go through the cycle. It's called the perimenopause, the period around menopause, where all of a sudden you start to find that the period start to skip a month. After skip a month, it start to come shorter, or sometimes it takes a longer time to come. And you see these changes happening, and you start to wonder. Some women will be wondering at 49 or 50, wondering if they're pregnant.
Yes. Yes.
So, I mean, of course, I've had women who have gotten pregnant at that point in time, but the most common phenomena that will affect the period will cause the cycle to become longer, and eventually an absent of the period for 12 months is the process called menopause. And as I said, the
Mm-hmm.
median age of menopause is between 50 to 52.
Okay. All
Mhm.
right. So we're going to now go break it down a little bit now. Persons having the challenges. And I hope I can remember all of the challenges that these women have told me about.
Mhm.
So I'm going to start off with this one because I got this one just this afternoon.
Yes.
So a lady saying we are in a little group and she said she stopped seeing all form of bleeding for 3 years. But
Mhm.
today, maybe it's because she hears we're going to talk about menopause. Today she
Mhm.
started to feel like when she normally would have painful periods, and so now
Okay.
she's feeling belly bottom start to hurt her, the same feeling that she would have had when she's having a period. So she's asking, I wonder if the period coming back. Do we see things like that?
So we do see things like that where after an absence of period for 3 4 years, a woman now present with period or bleeding, and that's called
Mhm.
postmenopausal bleeding after the menopause era, and it's a very important
Mhm.
symptom that need to be explored. Women with postmenopausal bleeding, we now have to rule out the
Mhm.
main thing is womb cancer, endometrial cancer. So the womb is where the
Mm.
baby develops. Sometimes the
Yes.
lining of the womb can become thickened over time by different factors. And after menopause would have reached and you start to have bleeding, then that need to be dealt with by a specialist, a gynecologist who will evaluate the bleeding
Okay.
to ensure that it's coming from the genital tract and not from the anus. And of course, once the bleeding, we look at it, we quantify it, we then now want to investigate this bleeding. Most commonly, we'll do a examination, body examination, feel the uterus, pelvic exam, check on the size of the uterus, look at the vagina, the cervix to see where this bleeding is coming from. Then now we'll
Mhm.
want to do maybe an ultrasound. The ultrasound is a device that looks at the uterus to see if the walls are thickened, and then we extend the investigation to get a biopsy where we tend to use a little
Okay.
device to remove a specimen from the womb to ensure that this little bleeding that is happening after the woman has gone through menopause is not cancer. Once you'd have ruled out
Oh.
cancer, there are other things that can cause bleeding after menopause. Things such as, polyp, like little fleshy growth, which are benign. Things such as
Mhm.
an infection could cause bleeding. You could have post-coital after sex, some bleeding is there because menopause itself, it's a condition where the estrogen hormone that a woman's carries a woman through her cycle is now limited, or it's on its down low. So what happened is that
Okay.
once there's not enough estrogen, the vagina become, they call it atrophy, meaning it become dry. You can have itching, you can have painful sex. That's where we're going into the symptoms of menopause. So all these issues, menopause can lead to little bleeding, where we have to evaluate, investigate, find the cause of bleeding. But the most thing, you want to rule out a womb cancer in a woman that is bleeding
Mm.
after the menopause era.
I hope she's listening, and I hope she would have heard that she need to go check out something, something. Right.
Yes,
Okay. So
and not to cut you, Dr. Asha, one other thing to
that's
rule
all
out
right.
to be infection can cause bleeding. So these are good things:
Right.
infection, pelvic inflammatory disease, infection, that long-standing infection can cause bleeding. So you want a physician or a specialist to look at the different spectrum that can cause
Mm-hmm.
bleeding, even fibroid. Women at 50, 54, 55 can have fibroid cysts that are causing bleeding. But of course, we want to take a thorough history, examine the
Right.
patient, then we do some investigation, and then we come to a diagnosis.
Okay, good. All right. So then I'm asking you a lot of the questions, so you might be going back and forward because I'm asking like how I got them. So the other thing now we want to look at, everybody talking about it, is hot flashes. Yeah, and you hear my my studio host I said, they want me to talk about the hot flash so badly, me nearly get it too.
Mhm. So,
Yeah.
so hot flashes is the broad term that defines it's called vasomotor symptoms. So this is
Mm-hmm.
hot flashes are caused by an absence of estrogen. So once the
Wow.
estrogen is gone, you're gonna have the hot flashes, right? And not just the hot flashes, but you'll have accompanying night sweats. So what tend to
Mm-hmm.
happen? Hot flashes in 75% of the cases the most common symptoms of menopause. Where you just everybody else is cool and nice like cucumber, and you just hot.
Yeah.
Even the place cool
Hot
like
buzzard.
ice. You just I would know you're extra hot, but you're just super hot. So
Yes.
when the body when the body lacks estrogen, the body
Mm-hmm.
responds by releasing these thermostatic mean temperature related phenomena that releases heat in a woman's, and that's where you have the hot flashes. And as I said, it's a form of vasomotor symptom. Vasomotor
Mm-hmm.
meaning you have other things like sweats and also, yeah. So
Right.
hot flashes is the most common symptoms. And I don't know if you want me to go into the treatment as yet, but
Yes,
we will
man. Each one
eventually
talk treatment for each one.
with hot flashes and
Mm-hmm.
the sweating. The reality is
Mm-hmm.
that there are certain conservative treatment that can be used. Of course, you find yourself under a fan, drink some cool water. Some persons exercise diet. Of course, there are hormone replacement therapy because remember, the the hot flash is caused when the estrogen is limited in the body or no
Mm-hmm.
estrogen. So once you try to give back some estrogen, be it through you have some plants that have estrogen
Mm-hmm.
or the hormone
I prefer that
therapy,
part.
which you have to be careful in giving. Yeah, man, very careful in giving hormone replacement therapy because you don't want to give it to somebody who has maybe a breast cancer that is estrogen driven or some other
Mm-hmm.
sort of cancer that is. So we want to screen the patients who will get estrogen replacement so that it can counteract the effects of lack of estrogen leading to the hot flash or the atrophy of the vagina or the night sweats. So in addition to the vasomotor symptoms, you have the urogenital system, which is the vagina and the uterus can become atrophy. Atrophy mean the cells are dwindling. Now
When,
that can
yes.
lead to a few things. Can lead to itching in the vagina, recurrent urinary
Yes.
tract infection. It can lead to painful sex. It can lead
Yes.
to just sexual dysfunction. And of course, when a woman is in her menopause, that should be the best and the most awesome time to have sex because you don't have to worry about a baby.
Not true. Not
But in
true.
reality,
Hey.
you can,
Yeah.
sex uncensored on, just
Yes.
yeah.
Freely.
But the reality is that if you don't understand menopause, the symptoms of menopause can drive you away from having sex. So when you think
Mm.
about the dryness in the vagina, the painful sex, the lubrication is lacking, we now think of ways and means to address it.
So prevent
Again,
that. Yes.
hormone replacement therapy is good. And if you have a gentleman in your life, woman that is very creative, that can, chicken can be looked after 100 ways. Can be steamed,
Of
fried, fricassee, you
course.
name it. So you have
Oh yeah.
the man that is skillful with the remedy, yes, the fricassee and all those stuff. You can use
Hmm.
your lubricants.
And
Your lubricant. You
different.
can try to.
Yes.
You you have different
Yes.
therapy, estrogen. supplement that can be used down there to drive some more secretion and get things going for those who are
Right.
wondering why they're having painful sex in menopause.
Yes. And as you talk about the sex part of it, some women also find because I have friends who are on either side of the fence. Some have no low libido, less interest in sex, and maybe it's because of the pain and all of that. So mentally they shut themselves off. But I have some friends who I don't know where they buy it, but them sex drive turn up. During that, all of a sudden they have a new lease on life. I even have a friend who had nobody for so long, and as soon as she hit menopause, she wants somebody. So what do we do? What I know these are hormonal response, but talk to us a little bit about that season. I want to tell a little story quickly. I remember as a child, I can't call the people name, can't even call the community I was living in. Who no. But I was living with my grandmother, and there was a lady who was a member of my grandmother's church, and as children, we're all up in people's business. And I remember they turned this lady out of church because she was keeping young boys. And she said she had to keep, because her husband had died. And so she had to have a man, and she had to take up nobody to go sit down on veranda and fan her. She wants somebody can do more than that, because her doctor told her that while she wants to keep healthy, she have to keep doing it. So therefore, she don't want a young man to fan her. She wants a young boy who can please her. And so she eventually married one young boy too. But what
she wants to swing on the chandelier.
Yes. Yes. Doc, somebody just said next time you need to be in studio when we're having these conversations. Yes, continue. Yes.
Right. So, to be honest with you, the estrogen drive libido. And most time when you have limited estrogen, the libido goes down. But to some persons, sex is more mental than anything else. And when it speaks of mental framework in sex, they're not just thinking about the fact that, hey, I'm old, I don't have much estrogen, so I'm going to lock down. They're now thinking of ways and means to explore and to do some crazy things. And especially if they had a healthy sex life with somebody who is not just a missionary. You want somebody who is evangelistic, somebody who is somebody who can take it to another level in the anointing of sex.
Yes.
So, the point I'm trying to say, despite the fact that the estrogen may be decreased, once you have creativity, persons who can know, say, hey, you can add back things. There's the Viagra, they're different. The lubrication, they're different.
And the CBD oil works wonders.
Spice up. Exactly. So there are different ways and means to spice up the sex life. So people with a healthy mental attitude towards sex will be more profound in their menopausal state. They'll act better. But the type of person now who may not necessarily, have enhanced libido is those who say, okay, fine. You focus on the symptoms. Focus on the hot flash, focus on everything, and you're not, embracing a positive self-image. And you have some older ladies who are menopausal, and when you see them, us young men out there start to wonder, wow. When you check their age and they tell you they're 67, you'll be like, you're lying. Because they have a positive self-image and they carry themselves in a manner that even with menopause, you realize that the body loses its elasticity. And the collagen network that is needed in the body is lost. And so you find a little wrinkle come here and there. But of course,
and they need to work hard. And you have some women now who are going to do the exercise. Yes, and we having a little
dermatologist
here, but so as a mature,
work out the exercise.
Work out the exercise, they tighten up the muscles,
right? They do some.
And they look good. And because they're looking good,
And you
young
know what
guys,
is it? What
young
is
guys
it?
can call to them too. We're
Size
losing a
too is
little bit. Okay, you're
build
coming
the
back.
pelvic
Mhm.
muscles. Lose its
Yes.
integrity. Down there has a grip,
Mm-hmm.
that powerful grip.
Yes.
And then now if they end up
Yes.
get that
Yes,
grip,
can do the work.
that normally, yes.
Yes. So I know your internet keeps going in and out, Doc. Do you want us to join by online by phone? So we lose it. The internet is acting up, and this is a wonderful conversation that we don't want to lose. We're going to see if we get Doc back or if we have to join in by phone. So Doc, you're back.
I'm back.
We see you
I'm
coming
ready
back.
again.
Oh, beautiful, beautiful, beautiful. Because I don't want the ladies to beat me this evening. So if we're gonna give you notice from now, Doc. If we lose you and you're not coming back, we're gonna call you by phone and complete this conversation. And also, I just got a message to say I hope Doc knows that one session can't do this thing. So you're already being given notice that you will
Not a
have to
problem.
come back. Yes, so as we're talking now, so we're talking about women who are taking
Not a
care of
problem.
themselves. The next thing that we are being asked now is, why is it that some persons feel like they're losing their mind? They're going crazy.
All right.
Mm-hmm. So you have some women who lose their mind or feel like they're losing their mind. They feel like they're going crazy, feel like they can't make it through, not sure what is happening with them, and they're just crying. And there's a friend that I had referred to you, Doc, some time ago, and she was almost ready to lose her job because of what she was
Yes.
going through. Tell us about that part.
So with menopause, it affects every organ in the body, and mentally, when the estrogen level is lacking or has become
Yes.
low or decreased, you find that there's certain neurons in the
brain, yes.
brain that estrogen drives.
Right.
So when those neurons are not served by the estrogen, you find that women become irritable. They become, they lose concentration, they become depressed. Yeah, man, they become, they just everything easily and affect the fit of going to be affected by anything in life. It is going to be menopause. So you find that when we're dealing with menopause, we look at it from a holistic perspective. We look at the different organs that are affected. So you find that the ladies who become depressed, part of the therapy is psychotherapy, where we have groups being formed that people talk about the different aspect of menopause that affect them. Programs like these that comes to their rescue to say, hey, you're not the only one going through this, your other persons. This is what they go in and see the psychiatrists, or even the gynecologist. We sometimes prescribe antidepressant to help with the depressive mode. Sometimes we have labile mode to it, But of course, the most important thing is diet, exercise. You have a supportive group. And then you find things to get involved in. I've known of persons who have had menopause and are going through terrific menopause symptoms, but you'll never know because guess what? They are so active, they're so involved, they're so caught up with other things that when the time come, like different women sit down and they're talking about menopause, she's like, I can't even recall going through these symptoms because their mind was
miss it. Yes.
in reading a book, being involved in writing a book, being involved a part of a program, doing outreach activities. So there's a psychotherapy aspect, and psychotherapy means a mental healing, a mental strengthening, a mental mental part of menopause that oftentimes is overlooked.
Yes.
Menopause can drive women to become depressive, suicidal. I've had a lady who she lost her job because of menopause. And as you said, I take her in, sit her down, counsel her, put her on some antidepressant, get her involved in a group network. And to be honest with you, she came around and she was just totally doing well. So one of the most important
Okay,
aspects
and
of the
that do happen.
menopause
Yes,
is the mind. Don't forget the mind. It
mindset.
affects the mind. And especially those who are not strong in terms of their mental fortitude. Once menopause hit, they can move from the king's house straight down to the arms house.
Not true. It's true. That is so true. Okay, so another question that I'm being told. I'm just doing the people in question this evening, dog. So somebody wants to know from right now when this thing going to stop. When is it
You know,
expected to stop? At what age? Because this person, they heard you so talk about mean age of 55. This person is once somebody said that hit 60 and they're still having hot flashes. Well, go
listen,
on.
to be honest with you, I mean, the literature will tell you it can go up to maybe anywhere between 6 to 10 years. But the reality is,
Hmm.
once you adapt yourself to the symptoms and you find ways and means to treat it and to get
Yes.
around it, some persons don't even remember that the symptoms exist. I remember my grandma, she was 95. Matter of fact, God bless her soul, she died at 95, 96. She had her last child at 52. Yes, 52.
Hmm.
So when I asked her about menopause, she's like, huh? What that? Because she was
What?
so involved at 52, she was a mother. She was caught up in taking
Right.
care of her and doing all these stuff. And it's not to say the symptoms weren't there, but she occupied her mind and she became adapted to what was happening to the point where she forgot that menopause really exists. So what I'm saying is
Yes.
that you can determine the magnitude to which menopause affect you in that you form support groups, you eat right, you exercise, the different organs that are affected, you would have taken, antidote or
Yeah.
medication that is needed to help. And then once you deal with it, you'll find that some person might have the symptoms only for a year, some only 2 years, some it can go up to 10 years. If you do nothing, it will affect you. But if you do something, you can counteract the effects.
And that is important. That is
Yes.
important.
And let me just
So, okay.
let me just inject
Yes.
this as well. So the other organs that are affected, the
Mm-hmm.
cardiovascular system, the heart, women, estrogen has a protective effect on the heart. So you find that when the body lacks
Yeah.
estrogen, you're more prone to increased cholesterol, heart attack, etc. So you find that
Mm-hmm.
persons in the older group who are menopause tend to come down with heart attack if you're not exercising, eating healthy, etc. Also, with menopause, your bone density, the bone will give you frame and that
Right.
strength. The bone
Mm-hmm.
become brittle, the bone break down because lack of estrogen is needed to help form your bone. So when the bone become brittle, any little you broke something. You broke all your head, you broke your vagina. Sorry. Your vagina don't have any bones, but I'm just saying that
You break the
the
girdle bone around there, so yes.
break some bones in your body. And that's why it's encouraged that if you're going through menopause, calcium replacement. And you mentioned about being in the sun. The sun help with
Yeah.
vitamin D, which help to form calcium. So those things are good. And again, with regards to the cardiovascular, the heart, once estrogen is out of your body, prone to heart attack, prone to high blood pressure, prone to
Mm-hmm.
high cholesterol. So you have to know, remember to exercise, remember to eat right, remember to do the right thing, drink less smoking, which of course it's not ladylike to be smoking, right?
Right.
I think that's
I've
prejudice.
been saying it.
It's not ladylike.
Not ladylike at all. Like, I was even saying to a lady yesterday who she's really going through some serious menopausal situations. And I was saying to her, you need to her husband as well, because he was with her. And I was saying to him, if you really love her, you're gonna stop smoking around her. I
That's
can't tell her
true.
to stop smoking completely, because that's your choice. But for her health reasons, you need to stop smoking, because she was talking about sometimes she's feeling okay, and then by the time she smell the smoke come, like she get irritated and she want to lick down somebody, and all of that. And I said is that the hormonal response to the negative impact of the smoke. And I said to her, I'm no doctor of medicine, but I believe that's what is happening. And I was suggesting to him If you love her enough, you'll stop smoking around her. You might just stop smoking altogether if you love yourself enough as well, because he had this hacking cough, and I believe it's smoking that's causing it. And
Yes,
so
yes.
now to hear you talk about the smoke and the impact it does have on women going through menopause is another thing. But do you, in your practice now, do you find that younger women are starting the menopausal journey earlier or later in this dispensation that we are now living?
Well, in this dispensation, you find that one of the ways you can go into menopause is through surgical means, and some women don't want to have any kids.
Yes.
They just take out the uterus, take out the ovaries that produces the estrogen. So you find that the type of women that
What,
are in
Doc, hit a
develop.
pause. Hit a pause, Doc. Hit a pause. Are you telling us that there are women who are doing these kind of surgeries just not to have kids?
Yeah, man, you have women who decide they're gonna take out the uterus, turn the internal organ in and out, just to, whether it be a transsexual or not just that,
Oh,
but
yes.
we just don't want to have any kids. So here, take out my uterus,
Children.
take out my ovaries
So
as
just take
well.
care of it from now. Okay.
So you can have surgical menopause being generated. Or to be honest with you, you can have, like, if you have a family history of early menopause. So you have some women,
Yes.
their parents, the mothers or the aunts being into menopause from
Mm-hmm.
like age 40, they too can
Mm-hmm.
have menopause. And then the next thing is that you have an upsurge of cancer. The womb cancer or
Yes.
the cervical cancer that requires chemoradiation. So the chemoradiation destroy
Mm-hmm.
the ovaries. So you can have these women now, in addition to this stress and the distress from cancer, lack estrogen because
Yes.
of the different therapies. So you find that this era, you'll find a lot of younger women, because of one reason or the other, now developing early menopause.
Oh, yes. Because I know I said it to Julia when I came in that some women are going into menopause because of surgery and all of that. So you have just confirmed my thought on the matter. Okay. So the next question we want to talk about now is, when it comes to menopause, is it also impacted by how early you start having your period? Does that have anything to do with it at all? Did you hear me, Doc? Okay, I think you have frozen a little bit. So I will continue talking until you come back to us, Doc. Yes, so one of the things is a school of thought. I have no proof of it, and I'm waiting until Doc is unfrozen to come back. His internet is acting up.
All
Okay,
right.
so Doc, you're back. Did you hear my question?
There's that. All right.
Right. Oh,
I'm
it's still
back.
breaking up.
Santa Claus is
Yeah, you're
here.
back. Good. Yes, sir. Good. Beautiful.
All
So,
right. So you
yes.
asked, you would have asked a question if early menses would have
Mm-hmm.
contributed to impact on menopause, and I said, relatively, I mean, absolutely no, but
Okay.
relatively, some persons who had early menopause, early menses, it can increase their risk for different conditions,
Oh, let's talk about that a little bit.
such as maybe womb cancer, ovarian cancer, those things. Would have not
Mm.
have any kids, and they have early menses and late menopause, it opens up the window
Mm.
for the use.
You're gonna have to repeat that one, Doc, because you went out a little bit, and we want persons to get that one.
Uterus to not be in rest. And when the uterus is not rested, you have excessive growth of tissues, abnormal tissues in the
Okay.
uterus.
Okay. So now, Doc, you're giving me another school for thought. because some of us women, like myself, I started having my period at the age of 9. So I started very early. So, you're giving me food for thought that I'm going to have to share with some other younger women who I know have started early themselves
I'm
as
seeing
well.
everybody. And what is happening to my internet?
Okay, you're back.
Oh, my.
Okay, so you keep going in and out, but we will have to do this program all over again. However, you're hearing us now? Okay, you're gone again, Doc. Okay, so while Doc is having these challenges with his internet, we know how the internet goes already. We know how this network thing goes, and Doc is always fighting to come back. So he's fighting to come back now. But while Doc is
I'm,
getting back, Doc, you're hearing me again?
I'm hearing you loud and clear.
Right. So Doc,
I
you
am
know this is
hearing
a
you.
sign though, telling you that the next time you're going to have to make an effort to be in studio.
I will be in studio the next time. I gotta be in studio because
Beautiful.
I want my audience to
Beautiful.
feel me, see me. I don't want no interruption because
Yes.
that's not healthy for it when you
Awesome.
have interruption.
No, it's not
So
healthy at all.
yeah. So the
Yes.
question was if having early menses impact on menopause. And I was
Yes.
saying relatively maybe, but absolutely no. However, early menses and late menopause can have your uterus being, it doesn't go through a phase where it rest, have not having any kids,
Right.
etc. So it can put you at risk for womb cancer, endometrial cancer. So you'll find that women who have
Mm.
early menses and late menopause are more prone to having bleeding after they would have attained menopause. And as such, when you have somebody who
Mm.
bleed having a period in the latter part of life, you want to take any family history of womb cancer, factor things in to say, is this person at increased risk of having womb or endometrial cancer because they have had early menses? So that's the
Mm.
link that is there. It's not a strong link, but
Okay.
that is where I take the conversation.
Okay. 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 All right. So, Doc, I know our time is winding down. So, I want you to give us um some not necessarily cure, but managing ways of
All right.
managing menopause or should I say counter the impact
Yeah, man.
of
So
menopause.
how do we counter the
Yes.
impact of menopause? So it's a
Yes.
holistic approach. Holistic
Yes.
means it's not just one method, it's not just the doctor, there's a counselor, there's a
Mm-hmm.
psychologist, there's the group therapy, the community aid. So they're hormonal and non-hormonal therapy. You would have heard about hormone replacement therapy, where
Mm-hmm.
estrogen supplement is given to our patient to add back estrogen. And of course, you don't want to give hormone replacement therapy in people who have had pulmonary embolism, had a clot, or had some thrombosis, some clotting issues, or even have breast cancer that is related to estrogen. Those persons
Mm-hmm.
you don't give hormonal therapy. Then
Okay.
you have the non-hormonal therapy where you deal with the body and the mind. So you have your acupuncture, you have your massage, you have
Mm.
your reflexology, you have even certain plants that has estrogen. They call it
Yes.
phytoestrogen. So there are some plants that the ginseng, the merengue, all these plants that has the estrogen um, extract
Yes.
that can be eaten or can be drunk in tea to help to minimize the effect of menopause. Then you have the hormonal regulatory means. Of course, those persons who are depressed, you can give the antidepressant. Those persons who are
Mm-hmm.
having bone, osteoporosis, meaning bone deficiency or calcium deficiency, you can give them back calcium therapy. And then, of course, the good old sun that you say can help to form the
Yes.
vitamin D. And importantly, group therapy, persons who have similar effects from menopause can meet together, discuss how each other go through it. And don't forget exercise, diet,
Yes.
having a positive self-image. Of course, you are maybe 60, 70, but when a young guy look at you, they don't say 60, 70. They see 20, they see
No,
30, they be
and they
like,
call you a liar.
exactly. So once you have this positive self-image and you project yourself and you take your mind off the symptoms, trust me. So again, in summary, hormonal therapy or non-hormonal, the things affecting you around, you have your exercise, your diet, some person into their bush herbal medicine, the Chinese medicine, the
Mm-hmm.
acupuncture, the reflex,
Yes. Okay.
the meditation, all these things. And don't forget to pray.
A prayer.
Don't forget to pray. It works. Some person listen to some soothing music. Some person, read some books. Some person play some game. There are things that different person use to mitigate the effects of menopause that can be discussed in groups therapy, and it help along the line.
Yes. And also
And don't
include
forget the
your partner
counselor.
if you have one.
And that's important. Your partner must be aware of menopause so that they can understand what you're going through. They can sympathize. Some men just love to jump and do their thing. They can understand that she's going through menopause. So maybe she needs
Yes.
some lubrication. Maybe she needs a little bit
Mm-hmm.
of tactile tap with that aspect of maybe let me not get there because somebody rebuked me. But the Bible said, the Bible, let me preach a Bible. The bedroom,
Yes.
let people bedroom and for them business. If they want to touch it,
Yes.
lick it, whatever, that's their business. So
That's
once
their
there's an
business.
understanding
Right.
man who knows what menopause is, get her the AC. Get rid of the fan and give her the AC so she can cool down.
Mm-hmm.
Women like money and expensive gift. Focus on buying her some expensive gift and giving her some money. When she forget about all the symptoms of menopause. And trust me, you'll be the happiest man in the world. Just give her what you want.
Doc, somebody's asking if you're married.
A nurse snatched me. Nurse Carisha Wallace. She saw me one day and said, I'm going to snatch you. I'm going to lock you down. So she locked me down for the last 8 years.
Good girl. Good
And I
girl.
say, I
Good
didn't
girl.
want no bail. She's taking good care of me.
Awesome. So, Doc, before you go, the other thing I wanted, as we're winding up now, please tell people how can they find you. That's the last thing we're going to talk about for this evening because the time is upon us. Well, how can persons find you to get your service?
So you can find me in several places. Importantly, I'm at
Mhm.
Falmouth Hospital. I'm also at the
Yes.
Ladies Medical and Urgent Care in Falmouth. The number is 224-4514 or
Mhm.
456-3196. I also work out of an office in Brownstown, Burlington, also in
Okay.
St. Anne at Elite Diagnostic, where the new KFC is, right in St. Anne there. And I'm in Mobile, right? I'm in Mobile right now. There's three offices in Mobile. G West,
Yes.
Bay West Fairview, and where
Mhm.
I'm at now, Secmec, Boog, ATL right there. That's the office I'm at, looking so handsome.
Okay. Okay.
You can feel free, and if you search into it, I'm there. All right. So whichever side in the
Okay.
west you are, you can find me. And I look forward for the next session, which I'll be in studio,
Yes.
and I'm coming
In
ready.
studio. Yes.
Let's go.
Yes, yes, yes. And so, Doc, we thank you for sitting down with us. We know you have a very busy schedule. And so we thank you for clearing this hour for us. And we know we had our challenges, but we look forward to us doing all this all over again when we'll tie you down in studio so the guests can have a conversation with you directly if they want to. And so thank you for sitting with us. Walk good, and we will talk afterwards later on.
Thank
Thanks.
you.
Good evening. And say good evening to that lovely lady that kidnapped you.
I will.
All
And
right.
say happy birthday to your husband for me, and you
Oh,
you
I
fix this.
definitely will. I definitely will. So,
All right, take
you're
care.
listening to Healing Moments on Fit FM 96.7. This evening we had for our guest, Dr. Radine Wallace. And we're saying to you, we talk menopause here. We're saying to our women, mindset makes everything a difference to everything. So put a healthy mindset, put God into the spin, and listen to us next week as we bring another awesome program for you. You never know what we'll be coming with. Whatever we come with is for your holistic wellness and your holistic health. This is Dr. Asha Mwendo on Fit FM 96.7. Your life, your music. Love you. Walk good. Stay blessed.